Heart disease often develops silently over many years. Many people assume that if routine tests are normal, everything is fine. But research suggests that in some populations, including South Asians, metabolic risk can develop earlier and sometimes be missed by traditional screening. This video is a simple guide to help you understand some of the hidden risk factors that may affect heart health. The most important message is this: it is your life. Please be proactive about your health. Be aware of your risk factors. Ask questions. Discuss appropriate tests with your doctor. Because when it comes to heart health, early awareness and prevention can make a life-saving difference. I sincerely hope this video will help you understand and be proactive and able to take charge of your heart health. This video was compiled by Dr. Siva Navaratnam, ChatGPT, my education partner, and all of us in Team You Eat Safely. Many people assume that standard cardiovascular screening works the same for everyone. The MASALA Study is a large US research study specifically designed to understand heart and metabolic risk in South Asians living in America. However, research from the MASALA Study, which examines South Asians living in the United States, suggests that traditional screening tools may underestimate cardiovascular risk in South Asian populations. Unfortunately, this message has not permeated around the world. This means that some individuals may appear low risk using conventional tools, even though their actual metabolic or cardiovascular risk may be higher. For this reason, researchers have suggested that earlier and more careful evaluation of cardiometabolic risk factors may be helpful, especially in populations known to have a higher risk of insulin resistance and cardiovascular disease. This slide is intended as a simple guide for the general public, not for doctors, to increase awareness. Anyone concerned about their risk should discuss appropriate screening with their doctor or specialists. One reason traditional screening may miss risk in South Asians is that metabolic changes often occur earlier and at a lower body weight. Many South Asians develop visceral fat around the abdomen, even when BMI appears normal. At the same time, insulin resistance can develop many years before diabetes is diagnosed. This means that standard tests may appear normal when underlying metabolic risk is already increasing. This is why awareness and earlier assessment may be helpful. Many routine health screening include tests such as fasting glucose, HbA1c, and cholesterol levels. These tests are important and widely used in medical practice. However, research suggests that some of these markers may detect disease later in the metabolic process, especially in populations at a higher risk of insulin resistance. This means that metabolic changes may already be developing even when these tests still appear within the normal range. In my case, they were normal for 14 years till I got the bad news that I was a metabolic disaster. Additional useful clue comes from relationship between triglycerides and HDL cholesterol. When triglycerides are elevated and HDL, that's your good cholesterol, is lower, the ratio between the two may suggest underlying insulin resistance. This metabolic pattern is also often associated with small dense LDL particles, that's your bad cholesterol, which are more likely to contribute to soft plaque formation in arteries. Another important cardiometabolic risk factor is high blood pressure. Research shows that South Indians often develop hypertension at a younger age and sometimes at lower weight compared with other populations. High blood pressure is important because it significantly increases the risk of heart attack, stroke, kidney disease, and heart failure. The challenge is that hypertension often develops silently without symptoms. This is why regular blood pressure monitoring is an important part of routine health screening. Another important factor is how body fat is distributed. In many South Asians, visceral fat around the abdomen can develop even when BMI appears normal. That is why waist circumference can be an important indicator of metabolic risk. None of my doctors measured my waist circumference. And to be frank, I did not know that waist circumference was so important. I relied on body weight, which now I believe is just a cosmetic clue. Central obesity, fat around the abdomen, is strongly associated with insulin resistance and cardiometabolic disease. Another factor increasingly recognized in heart disease is chronic inflammation. A blood test called high sensitive C-reactive protein, or hs-CRP, can sometimes be used to assess inflammation levels in the body. Research suggests that chronic low-grade inflammation may contribute to cardiovascular disease. In people with visceral fat and insulin resistance, inflammatory activity in the body may increase, which may contribute to soft plaque formation in arteries. In some situations, doctors may use more advanced tests to assess cardiovascular risk. One example is the coronary artery calcium score, often called a CAC score. This is a special CT scan that can detect calcium deposits in the coronary vessels, which may indicate early plaque formation. In certain individuals, especially when risk is uncertain, this test may help provide additional information about cardiovascular risk. The key message from this discussion is that traditional screening tests are important, but they may sometimes miss early metabolic risk in South Asians. So please, be aware of your personal risk and discuss it with your doctor or specialist. It may help identify problems earlier. Please take an active role in your health. It will help earlier detection and prevention. Thank you. Be safe.